Howdy, this is your Houston chiropractor, Dr. Tristan Wendt, and I'm joined today with...
Phil Yamamoto, Orange County, California.
So we're here is day 3 on the Advanced Chiropractic Equipment and Seminars. Phil's back in for his second seminar here, second 3-day seminar. So on day 3 here, he's already gone through his exam. He's ready to get his adjustment before he heads down to the airplane to head back to Southern California. What are some of the things that you've been covering this week with Dr. Johnson and Dr. Herman and Dr. Mick here this week?
Oh, fine-tuning the ring dinger, fine-tuning the Johnson BioPhysics adjusting on the heel drop table, and then getting coached on how to do a better history and a better physical exam.
Ortho-neuro exam.
Ortho-neuro
So
exam.
those are all very, very important things to ensure that we're providing the safe and effective approach to the Johnson BioPhysics and ring dinger techniques that Dr. Johnson's worked that 43 plus years on. So the medical histories, the exams, the ortho-neuros, everything that we do is very, very important because it's ruling out those pathological contraindications, because this isn't a technique for every single person walking the face of the earth.
No.
If you've had spinal fractures, currently have spinal fractures, if you've had metastasis of cancer, strokes, atherosclerosis, all of those things don't make you candidates not only for these procedures, but for most chiropractic adjustments in general. And so it's not just these techniques in this office and the techniques that we practice, it's really just practicing safe and effective chiropractic as it is in a whole. So,
Which this is chiropractic adjustment, bottom
absolutely.
line.
That's what it is. Yes, sir.
It's an adjustment of the vertebral subluxation, which affects neurology into the brain. That's what chiropractic is.
So let's now show them how we do one of those safe and effective ring dingers, Phil.
Okay, great.
There you go. But right here for me, head up this way. And people are thinking that these are just gimmicks or we're just wrapping towels around people's necks and yanking as hard as we can. You don't really see all of the histories and exams because those aren't things that we post online. Those are HIPAA compliant
They
information.
get bored and turn us off if that.
That as well. People these days are too much of dopamine addicts and want just that short, quick fix of the
They just wait to
ASMR
see us
cracks.
rip somebody's head off, but
That's
it
it.
hadn't happened in 42 years, so you're gonna start now.
Except the bones there in the
Yeah,
corner.
that's one.
He's the only one.
I bought him in the Palmer Library,
Relax those hands up on
so
your
he
chest.
can't bitch much.
There we go. You come down a little bit further towards me, Phil.
All right.
You probably hurt me more than it did him, because I flew into the door.
I remember that too.
Whoa.
Yes, sir. Got you locked in there now.
Oh, man. I feel like a taco.
Hopefully you don't feel like Taco Bell here in a minute.
No. We'll make sure.
Or a
Pick
hot.
up my table.
Relax that head all the way down for me. So as a reminder here, Phil, keep those teeth
That's
together
good.
for me.
Okay.
Nice big breath into that nose. Good. Just to time it up here with you a little better, I want you to take one more nice big breath. And then blow it all the way out. And then wiggle that left big ear for me. Yeah.
Oh, wow.
I want to hold off here for 1 second because again, something that I've noticed here, I felt only about halfway here. So
Oh,
Phil,
okay, if you want to do another
I'm
thing.
doing a double dare on you today,
Okay.
Phil.
Okay.
Because I know I only felt it to about mid thoracic.
yeah,
How far did
I-
you feel it?
About there, too.
Yep.
You anticipated it.
I'll catch you between books here. You should relax that hip there for me. And again, that's
Yeah,
really
you don't ever want
important.
patients rotating in there.
I want you slipping through on me, but I think you're on the last pin on this side, my friend. Have you scoot towards me as far as you can, because I'm also going to get you centered on the table. That's going to help as well.
There, that could be what's going on right there.
See, that's how much compression and form we get into the pins there from the tightness of it. That's so we're stabilizing the spine and we're not sliding through there.
Lord.
Suck it up, Buttercup.
Even though you're going back to Southern
I'm
California,
good. I'm good.
we're going to get you that hourglass figure back.
I'm not complaining.
Take a deep breath.
That may be too many tacos. Hold on up.
There we go. One more nice
Push
breath.
it out.
Nah, I feel you anticipate. There we go.
Nice.
Oh, man.
Big breath.
Where'd you feel that one at?
All the way out.
All the way down.
Okay, good.
Because I felt it all the way
Keep
down,
breathing.
too.
You always
See,
want
I-
to tell patients deep breath in through their nose, out through their mouth, because that's what's a calming respiratory method to decrease stress.
Your nervous system will want to tighten up after something like that because it's never
Well,
experienced
it's a little bit
decompression
fight or flight
sensation.
when that happens,
Yeah,
actually.
So Yeah, your body almost goes into like a freak out, like you said, fight or flight mode. And so then it's the chiropractor's job to remind you, hey, just take those nice deep breaths in through the nose, and that's what's going to relax a lot of those small muscles and a lot of the
And that's when
paraspinals
patients
around
start
them.
feeling that euphoric feeling and break down bawling a lot of times because they're pain free for the first time.
They start realizing their head's still attached.
Yeah,
they can
that's
talk,
right,
they can
yeah.
laugh, they can do all those things beforehand.
That fight or flight stress though is rough. And a lot of people have that already, anxiety, stress.
You tilt to the left with me. All right. One more here on this side. Big breath in for me. All the way out. A little bit there.
Can I ask a question? Why is there a reason why you do the neck right after the pull and not go back on that table and do it later?
The legs are out and relaxing.
So it's easier to release, right?
Yep. And-
That's what I thought.
And it's easier for the chiropractor because on the BioPhysics table, I'd have to get a lot
Bend
more
down.
lower, to do that. Whereas this table has the luxury of going all the way up to my
I
height,
feel it
so I don't
easy
bend
too.
down nearly as
And
far.
sometimes there's nothing to release though too,
Okay.
because the ring dinger gets it.
Yes, sir. We'll get you on the BioPhysics table next.
Okay, great.
In fact, there's a lot of patients that, including myself, that prefer just to get the ring dinger rather than the rotary.
Yes, sorry.
You're good.
Just in decompression.
Patients try to apologize all the time too for it, but that's on the chiropractor. That's my job to feel those things and know that those muscles tighten up, and that's not a time that I need to be thrusting. I need to catch you between bucks where those muscles aren't tightened up. You also need to stop sitting on that wallet.
Yeah.
You heard that Monday.
Tightens up just a little bit on the right when I bring it up.
Yeah.
So I'm gonna start on that right SI joint, and I'll kind of talk you through some of the contact points and things that I'm doing here too.
I usually have a gun pack, so I carry that, but I didn't take it here.
So for the right SI joint here, again starting on the medial aspect of the PSIS, kind of hooking it with piezoform there, and then driving it 45 degrees away,
Oh, yeah.
P to A.
That's good call, your assistings and your contacts.
Yep. And again, if you notice too, I'm not just placing my hand and smashing his pelvis around in all kinds of different directions. I'm
There's a
applying,
specific contact
Yeah.
and line drive.
yep, and I am applying tension before the thrust,
Right.
and then thrusting through that tension,
That's
just
right.
like with the ring dinger technique. That is the art of a chiropractic adjustment, is bringing that joint to its fullest range of motion, and then stimulating that response without breaching the paraphysiological integrity of that ligament that we're working with. So next film, start right there to L5. Big breath in for me.
That's why I use my hand all the way up.
Keep letting that tummy fall. Yes, sir.
See the line drive? See they go like this, now they go back a little around. Yep.
Last one here, okay? Big breath in for me.
Clean the
There we
line
go.
drive.
No, I'll give you a second to relax after that. I know those are deep.
Because that's where you're breaching the paraphysiological space, taking it to the anatomical integrity of the ligament.
Oh, feels good. Thanks.
Hurts so good sensation, huh? Or I can be a pain in the butt too, just like Dr. J.
It can help you lighten that wallet too, Doc.
You want it?
Where's your wallet?
How about it?
Take it off your hand.
You can buy another table.
Alright.
Hey man.
Big breath for me.
No, no. Should be right there.
Don't worry, I'll dance with you there. Big breath. One more here. I'll bring this piece up for you. That might help. Extend this a bit. Don't worry, I'm not gonna fight against you there. I'm just gonna wait till you're not thinking about it, and then I'll win. Keep letting those shoulders drop and sink towards the side. A little bit more. Last one. There we go. You feel the depth of those adjustments though, right?
Yeah.
Perfectly even now. Tell me that's how this feels in the low back and pelvis. Bring those legs up. So the next one here. So these are gonna be those cervical drops. And again, I'm always thinking visually here.
Yes.
I imagine what that lordosis should be looking like even outside this patient's body here, again, because I'm a visual learner, a visual person. That's how I see things here. So I go to C3, C4, inferior portion of that spinous, still got my tissue pull, and then I actually change my body angle to get to the or the line of drive that I want into the spine. So C3, 4, straight P to A there. 4, 5, P to A, little bit of S to I. There we go. And then now back onto T2. This is where I'm going to get the head back up over the shoulders, come to that inferior portion. Again, going straight P to A on this portion. Take breath for me, Phil. Good. And again, on those Thompson drop techniques, it's really, really important, specifically on these, that you don't just drop and recoil,
Right.
because that force will then recoil back into the patient's spine and not feel so comfortable. Again, there'll be deep adjustments, but you set and hold for a
Right.
half second and then release your hand off of the adjustment.
That's correct.
Have you go face it for me next, Phil.
See, there's a reason he's my replacement. He gets it.
So either, again, I'm feeling,
Oh, okay.
it's not one specific
how
thing
to
for every patient. I
visualize
feel
mental set
where
angles,
the
all that.
curve has straight.
I mean, that's all
I
super,
got it.
super important stuff.
I trust you.
Because if you jam those joints, they're gonna hurt worse. They're not gonna come back.
You get the hang of it.
I mean, this is really a practice building smoothness so too. Your practice will
Starting
grow
on the medial
more when you
aspect there,
get
and I'm not
people return
squishing
these
those together.
because
I'm
they're
going
not
back
getting.
up and over the head there, over the shoulders. Excuse me.
Not saying you're hurting people. I'm just saying that when you get smoother and
Arms
more
up to the side.
Yeah.
adept at it,
Maybe slide down a little
they'll
bit
follow
further
through
forward.
even more. And they'll want to come back.
Have you go a half inch up, because once I get through the ribs, it's not going to drop in. Perfect. So these are AC joints, contacting that acromion, driving straight laterally, and a crappy thrust on that right side, so we're going to do it again. Better. Now we're going to go clavicle, medial to lateral. So I know that's rough on the button there. Now anterior ribs. Again, I use a knife edge here to be a little bit more comfortable for the patient's aspect of it.
Yep.
And then I'm on top of the rib heads, again, tissue pull, driving lateral. I'm not just placing my hand and sliding on the tissue slack. I'm actually getting that slack out of there and then getting that thrust into the joint itself.
Brings tension just like any adjustment.
Last one.
You see the line drive though? It's more straight lateral with those ribs.
Even though I'm standing on the same side, because
Yeah.
again, textbooks are going to say you should switch sides, blah, blah,
Yeah.
blah, blah, blah. But for the efficiency of actually running a practice, because it's still a business, obviously I'm here to help the patient and do everything that I can to get you out of pain and teach you the things that are going to keep you out of pain. But again, I've got to be able to modify some things where I'm not having to switch sides 15 different
You don't
times.
need
during the
unnecessary
adjustments.
steps or procedures that
Again, if
take
you
up
understand
time.
the anatomy and the physiology and you understand the concepts of a chiropractic adjustment, as long as you know how those joints function, you can do almost anything you want
Right.
to get them moving in the right directions again. Yeah, I felt that in the knees. You felt it up in the hip at all?
Yeah.
Have you slide up for me? There we go. All right, Phil. I'm sitting next.
Thanks.
I'm talking about these here too, because I know there's a couple details that can go over some heads on this adjustment. So we're contacting bicipital tendon there, feeling to get that back into the groove of the humerus there. As we bring it around, I start to set my chest and stabilize the scapula, because if I bring that shoulder around and try to make the thrust here, all it's going to do is raise the shoulder up. It's going to raise that whole scapula when I'm trying to get a glenohumeral adjustment. So I stabilize that, isolate the movement into just that glenohumeral joint. Big breath for me, Phil. Bring this internal rotation, and then thrust
that
up
would
and
be nice.
away into that GH joint.
Very nice.
So again, those are the specifics that we don't talk about on every single video, but it's what I'm thinking about and what I'm doing.
And that's what we teach all of our
and
team
what we're
ring dinger
teaching
dogs.
with our dogs. And creating those neuroplastic changes, because eventually I'll be able to walk, talk, chew gum, and do all these things at the same time. Maybe look up for me. Yeah, I know you didn't hear that loud pop and click, but Dr. Phil, I know you felt that movement in that. Hold on. Let that shoulder drop for me. Trying to hold against some of these, huh?
Just have it.
You're just used to shitty chiropractors adjusting
Yeah.
you.
Don't worry, the new guy also doesn't have any heads on this trophy wall yet, so I'm not gonna start with yours.
No. Don't worry about it.
That's the one you bruised.
Oh man, I did lose.
Sorry about that first. There you go. That was. So I'm not afraid to go back in there and do it again if I didn't feel I got all the movement that could have been established in those joints.
Because you have to know the difference between that and hyperextending a joint too, though.
Oh, that's nice.
And another key portion here is I'm tractioning that joint, and then depending on which carpal bone I'm specifically contacting, I will then deviate, ulnar or radial deviate towards that side, and then drop through that.
Oh, that's nice.
To the attention to detail on the contacts and line of drive on every joint.
There we go, just like that, Phil.
Tristan gets it.
Whew, got me sweating here today. That's okay.
Right.
Stand up with me
Thank
next,
you.
and I'll shoot you one more time.
Okay.
Send you out of Houston the right way.
All right.
And this is the cherry on top of everything that we do here. This is actually stimulating the muscle spindle and Golgi tendon housed within every muscle of your body, but specifically the paraspinals that we're working with here to help relax these guys after all the adjustments that we just provided. Something that I've had to get over as a young chiropractor is that even if a patient is saying ouch, or even if a patient is kind of fighting against me on some of those adjustments, it's not because they aren't wanting it, it's because their nervous system is in that fight or flight mode and trying to fight against the pain that they feel. But it's knowing that the techniques and things that I'm doing to that patient, I have the confidence moving forward with it, that this is actually what's going to be getting them better, even though it may not be fun the first time or two that you're getting it done. And something that actually helped me learn that and get past that even quicker was starting as a patient in this office. Because I'm gonna tell you right now, it wasn't all dandelions and daisies the first day I was in here with Dr. Johnson getting those adjustments hurt. It felt like I was getting hit by a Mack truck on that first adjustment. But when I got off the table, started feeling the differences and didn't have any more of that sharp shooting pain down the leg, I was like, you know what? This is kind of like working out. We use that analogy all the time. It's not fun doing it the first time or two, but it's that necessary stress that our body needs to get us out of that cycle of pain and to get ourselves moving again. So,
Amen.
Phil, I'll have you go one more time, forwards and backwards with the head forward. And then show me that extension exercise, shoulders up and back, get that chin straight back, just like that. Last one. Relax those shoulders. One last time, forwards and backwards. Should be the smoothest of them all.
Yeah, it's great.
All right, down we go, my friend. Send you back to Southern California, a couple inches taller after this week.
Thank
huh?
you. Thanks, buddy.
So Phil, any closing words there to say to the crack addicts or the other docs out there watching this video?
Oh, this is a great adjustment. I love this adjustment.
And it's a reproducible adjustment too. Just takes some of the time, energy, and focus to learn these things and to learn the specifics on everything that we're doing in the
Yeah,
office.
it's the best adjustment out there. Nothing even comes close.
Well, thanks, Dr. Phil.
You're
So,
welcome.
how can they get a hold of you and how can they find you out in Southern California?
Oh, I have a new website, philthechiropractor.com, and if that's not working, I don't mind. I don't know why people are weird about their cell phones. I get out my cell phone all the time, but if you get a weirdo, you just block them. But anyway, you can text me at 714-235-1000, 714-235-1000.
And you can find us at
Okay.
advancedhoustonchiropractor.com here Monday through Friday and even on some Saturdays now, so watch out for some of those Saturday videos. So this is Dr. Tristan Wendt coming to you from Advanced Chiropractic Relief and Advanced Chiropractic Equipment and Seminars with Dr. Phil Yamamoto from Southern California.
Yep.
And we'll see you guys soon.
Thank you.